Label the major blood vessels of the pulmonary and systemic circulations. The circulatory system is organized into two major circuits, the pulmonary circuit and the systemic circuit, each with a network of key blood vessels essential for understanding imaging studies, surgical approaches, and common disease patterns. In the pulmonary circuit, deoxygenated blood leaves the right ventricle through the pulmonary trunk, which quickly divides into the right and left pulmonary arteries. These vessels branch into smaller arterioles and a dense capillary network inside the lungs. This is where gas exchange occurs. Oxygen-rich blood then returns to the heart through 4 pulmonary veins, 2 from each lung, delivering it to the left atrium. This reversal of the usual rule for arteries and veins is important clinically. Pulmonary arteries carry deoxygenated blood, and pulmonary veins carry oxygenated blood. From the left ventricle, oxygenated blood enters the systemic circuit through the ascending aorta, which immediately gives rise to the right and left coronary arteries that nourish the heart itself. The aortic arch then curves and gives off 3 critical branches. The first is the brachiocephalic trunk, which divides into the right subclavian artery supplying the right arm and the right common carotid artery supplying the head and neck. Second and third branches are the left common carotid and left subclavian arteries, which supply the same regions on the left side. Each common carotid splits into an external branch serving the face and scalp and an internal branch that passes into the skull to help form the circle of Willis, along with the vertebral arteries, which rise from the subclavian arteries and join to form the basilar artery. The internal carotids create the arterial ring at the brain's base. The circle of Willis provides critical collateral blood flow, helping protect brain tissue if one part of the supply is blocked. Extending from the subclavian arteries, the major vessels of the upper arms form a continuous pathway that delivers oxygen-rich blood to the arms and hands. Each subclavian artery becomes the axillary artery as it passes through the armpit, then the brachial artery along the upper arm. Near the elbow, the brachial artery divides into the radial and ulnar arteries, which run down the forearm and join in the superficial and deep palmar arches to supply the hand and fingers. Below the aortic arch, the descending aorta travels through the chest and abdomen. Along its path, it sends off intercostal arteries to the chest wall, the celiac trunk to the stomach, liver, and spleen, the superior and inferior mesenteric arteries to the intestines and colon, and the renal arteries to the kidneys. Near the pelvis, the aorta splits into the right and left common iliac arteries. Each divides into an internal iliac branch, which supplies the pelvic organs, and an external iliac branch, which continues as the femoral artery down the thigh and eventually the popliteal, tibial, and dorsalis pedis arteries of the leg and foot. These vessels are central landmarks for procedures such as cardiac catheterization and for evaluating peripheral artery disease. The venous return parallels these arterial pathways but is not identical. Deoxygenated blood from the head and upper body drains into the superior vena cava through tributaries such as the internal jugular and subclavian veins. Each subclavian vein is joined by the axillary vein, which collects blood from the brachial, radial, and ulnar veins of the deep arm, as well as the superficial cephalic and basilic veins of the skin and subcutaneous tissue. From the lower body, deoxygenated blood enters the inferior vena cava through the common iliac veins and their branches, including the femoral and great saphenous veins. Blood from the digestive tract follows a special route. The hepatic portal system collects nutrient-rich blood from the stomach, intestines, pancreas, and spleen via the superior mesenteric, splenic, and inferior mesenteric veins, sending it to the liver for processing before it empties into the hepatic veins and then into the inferior vena cava. Understanding the detailed paths of these vessels lays the groundwork for interpreting diagnostic images like CT angiograms, evaluating strokes and aneurysms, planning surgeries, and treating conditions such as aortic aneurysm or deep vein thrombosis.